Now, the Ministry of Health and Wellness is expected to ramp up its campaign against non-chronic communicable diseases, also referred to as lifestyle diseases. This after alarm bells were sounded and countries mandated to do more to reverse the high numbers of deaths and people living with NCDs at a regional health conference. The forum, hosted by PAHO in Barbados, strategized on ways of preventing citizens from falling prey to illnesses like diabetes, hypertension, among others. Minister Alvina Reynolds says what was clear during the talks is that the region is losing the battle.
There needs to be behavior change among the population, especially our young people. And what we're speaking about is person's exposure to alcohol, to smoke, the exercise or lack of it causing major problems, and our diet, what we eat, staying away from the fatty foods, the salt intake, the sugar intake. This is what's causing the 5, I think, most dangerous diseases that we see. We look at starting off with cardiovascular diseases, heart problems. Number 2, cancer. Number 3, diabetes. Number 4, hypertension. And also we have respiratory diseases. But in the mix of that, we have injuries. And surprisingly so, women are now taking over in terms of obesity and diabetes.
Minister Reynolds notes that women are important to the fight given that they head the majority of households.
When women begin to fall prey to non-communicable diseases, what do we expect of the children? What do we expect of the partners, the men? And so we are very concerned when we see women going down with cardiovascular diseases, with heart problems, with stroke. We have families to look after now. And so this is critical for small developing countries like ours. Our budgets are quite small, so we have to spend so much money taking care of interventions, treatment, looking at amputations. And with amputations and people being sickly in their productive years, we're looking at low productivity, we're looking at unemployment, we're looking at poverty. The state has to come in again. So if we are smart, we should know what our role is, and that is to invest a lot more in health promotion, health education, prevention, deal with those risk factors that we see affecting and causing our population to be sick.
Alvina Reynolds says she has returned home determined to create a dent in the local predicament.
As minister, I've always been preaching health promotion, healthy diets, healthy breakfast, drinking lots of water. I've been preaching it, and I try to live by example. But I think as a ministry, we will be doing even more now, because the message must reach the population. We must engage in new strategies to encourage our population to engage in behavior change for health and wellness.
Government spends some $1.4 million annually to dispense free medication to diabetics and hypertension patients.